Dr. Matthews, so excited to have you for this edition of the CHP Spotlight interview series. For those of you watching this and don't know who Dr. Matthews is, Dr. Matthews is a doctor of podiatric medicine at the Podiatry Center. They have two locations, one in Bethesda, Maryland, and one in Springfield, Virginia. Dr. Matthews specializes in sports-related injuries, specifically does in regards to the foot and ankle, and is a surgeon in regards to that area as well. So, Dr. Matthews, thank you so much for joining us today.
Cheers, my friend. It's good to be here.
Awesome, man. So first, let everybody get a chance to get to know you and what you're all about. What actually inspired you to venture into the field you're in?
Yeah, it's a good question. You hear stories of people growing up and having like, oh my God, I want to do this career. I want to be this kind of person. And honestly, for me, that just wasn't the case. When I was growing up, I had a mentor at home who was actually in the foot and ankle field, and kind of took me under his wing and it, exposed me to all that. And then it was just a perfect fit. And from that, honestly, I kind of just ran with it. I wish I could say it was like a passion of mine from growing up and it was all planned, but honestly, it just kind of worked out that way. So
that's awesome. No, I appreciate you mentioning that. And then you seem to have a specialty from our past conversations, and for anybody looking on your website, for example, which we'll share in a bit, that you have a specialty with the active and athletic population. What caused you to specialize sort of with that kind of audience?
Yeah, I love sports medicine patients and our advanced athletes for a lot of reasons. Number one, they tend to be a lot more demanding and they tend to be a lot more challenging, which is nice for me because you can really get involved with people like that. And they're very, very invested in getting themselves better. And as such, they tend to really, really pay attention and really get involved in their care because they know that if they don't do what's asked or do what they know they need to do, they're not going to end up getting better. So I think, the relationship with our pro athletes is a little bit closer. It's a little bit more one-on-one, and it's definitely a little bit more in depth because at the same time, these people tend to be more educated, both from a physiologic and anatomic standpoint, but also with regards to, functional rehabilitation and things like that.
Gotcha. And I appreciate you mentioning that. And I agree. I think it's so much more fun to work with people who just really care about.
Yeah, it's more engaging. They're into it. You're into it. The dynamic with all our patients is the same, right? We treat them like they're our family, and that's why people come to us. But with our elite athletes, it's the engagement is more, and the relationship tends to be a lot longer lasting as well.
You got it. And I think it's also from an ethical perspective, almost seems to make more sense because, we can, promote dependency on the people we work with if we really want to. But if we can give people the tools to also be able to help themselves because they care enough to do it, that's pretty cool too.
Exactly. And look, with regards to the foot and ankle, it's outside of the realm of infection and acute trauma. Everything's prevention because everything is an overuse injury. So if you are proactive and you get in front of it, you're never going to have an issue ever. It's just, it's as simple as that. But doing that is easier said than done. So
sure, that's a good point. And then that kind of leads into my next question. So would you mind telling us about like some of the most common like injuries and ailments that bring people in to see you? And I know that list is long, but what are they, and what are some common maybe common reasons why you often see these come into your office?
Yeah, so that's a great question. Everyone's practice kind of takes their own little tinge, and everyone kind of falls into their own little niche and whatnot. Most of my patients that are not infected or have acute trauma all fall under the category of what we call overuse injuries. And that's just someone pushes it too hard and they don't listen and it gets worse and worse and worse and they eventually end up in our office. So what that means from a practical standpoint, that's our patients with heel pain, ankle sprains, tendonitis, and then for some reason, the majority of my practice has become stress fractures, and I have no idea why that is. Maybe it's just because I'm the guy that looks for them, but that's what it's become. And it's interesting because a lot of that stuff is very much preventable, but that's mostly what we see. And what was the second half of your question again? Sorry.
Yeah, just you mentioned obviously the overuse aspect of this and in regards to stress fractures or the different tendinitises. What are some of the, I guess, in regards to those things you described, what are the common I guess, some of the common reasons why you sometimes see them come
Oh,
into your
yeah.
office?
Yeah, yeah. Well, I mean, obviously the most common reason is pain. The question is, why is the pain there? And, a lot of people think pain is something that you should push through. And there are instances definitely where that is the case, in terms of like endurance and lactic acid buildup and things like that. But with regards to the foot and ankle, unfortunately, pain down there is not something you should push through because it's always going to rear its head later. And if you catch it early, just like anything in life, it's always much easier to deal with them later. And then, in terms of timing and presentation, I mean, it's obviously multifactorial, but it's very seasonal. We live on the East. I'm from Southern California, where no one ever has an issue with vitamin D or anything because you can do whatever you want year round. But here on the East Coast, spring, summer, when people are getting out and starting to, go from no activity to let's go run 5 miles every day, that's when people tend to pour in. So it's also very much a seasonal thing.
Sure, that makes a lot of sense. That makes a lot of sense. You can kind of see ebb and flow. And now for those of
Yeah,
us,
and
yeah, go ahead.
oh, sorry. No, well, I mean, at the same time, we're in the realm of COVID-19, right? And our lives have been fundamentally changed in a way that I don't think people ever anticipated ever having to deal with. And everyone's kind of running on the fly here. But prolonged periods of immobilization and inactivity, and then people being overactive and really wanting to go out and get after life because they feel like they missed a lot of the last couple months. Think situations like that, going from a sedentary lifestyle to an extremely active lifestyle extremely quickly. Unfortunately, your body's going to talk back.
Yeah, I think that makes a lot of sense. I know it's almost like it's not bad to be necessarily doing a lot of the activities people are inherently doing, but if you aren't prepared for that because maybe you are just stuck at home during quarantine, and then all of a sudden maybe some of the stay-at-home orders eventually over time get a little bit more loose and you can go outside more, and now you just go 0 to 60. Well,
exactly.
It's not that what you did was bad, it's just how prepared are we for that. It makes a ton of sense.
Yeah, your body's not a car. There's not just a gas pedal you push on, everything works. So
right, wouldn't that be nice, right? It's funny. It's funny you say that. I know an old mentor of mine used to say cars and engines, they're complex, but once you understand them, it's not like they're going to grow a new spark plug. But the human body, well, it's complex. It's not complicated. It's constantly adapting and changing, and you can see new things there. So it's just interesting to use that analogy. Now, you mentioned,
and that's essentially what we do, is help people respond to those adaptations in ways that are A, going to solve their problem, and B, prevent it from coming back in the first place.
I love it. I think that's a great approach. And you mentioned these current times we're in. Obviously, people are dealing with so many challenges right now, and a lot of that is they're just stuck at home. They're not able to. The gyms are closed. Their fitness routines are interrupted. They're not able to enjoy the active lifestyles that they love to. So what are some things people can do from home to hopefully avoid them having to come into either of our offices when all this is over?
No, that's a good question. And look, the right answer to that question is going to be a little different for everyone. But if I had to point to one thing, and one thing that I think is incredibly important, is yoga and physical functioning and stretching. Everyone who comes into my practice, virtually everyone, gets a yoga prescription in one way, shape, or form, and a lot of people pay attention to that. And a lot of people don't. But we're in a time now where you can easily find things on the internet, yoga classes, things like that on YouTube, and lots of corporate yoga studios are offering them for free. There's a lot of opportunities out there to take advantage of that. And I think doing a daily yoga routine will A, help. I mean, it becomes a routine. You do it every day, and B, it will help keep you conditioned and get you stretched out so that when all this ends, whenever that is, hopefully sooner than later, obviously, getting back to activity won't be as gruesome. But I definitely 100%. If everyone could just do yoga every day, like I'd be out of business.
That's all right. We'd find something else to do. But I appreciate you mentioning that. And then when we look at your website, so if you want to find Dr. Matthews' website, it's www.paulrossdpm.com.
Paradoxically, yes.
Yeah.
I am not Paul Ross, but that is our website for historical reasons. So
That's all right. I'm glad you clarified that. But if you go on that website, you'll see obviously a lot of even a bigger summary of Dr. Matthews' background and expertise there. But in addition, you'll also see a lot of the really cool and unique treatment options that you have available at the Podiatry Center. So things such as Shockwave Therapy, MLS Therapy, digital X-rays, just to name a few. Could you tell us, I guess, a little bit about some of the treatments that you provide at the Podiatry Center? It could be those or any of the other ones that you are particularly excited about or that you see a lot of benefits for in terms of the people that come in to see you guys.
yeah, so we pride ourselves in kind of being a one-stop shop with regards to meaning that anything that walks in the door, we can take care of it in a very, classical conservative way or very aggressive with modern techniques as well. I think from a preventative standard, the yoga is important and physical evaluations at places like CHP, especially for our advanced athletes, is critical for preventing things. But once pathology exists and you're in the door, the question is how to deal with it, right? And from a surgical standpoint, I'm an advanced reconstructive surgeon. I trained at Harvard, faculty at Hopkins. That's what I enjoy doing. But having said all that, it's fun for me, not necessarily for the patients that have to go through the recovery from some of those processes. So we focus heavily on conservative and non-invasive means and use really the OR only as a stopgap for things that we can't treat conservatively, or people who have failed conservative stuff. So with regards to that, we engage therapies like the MLS laser. That is an infrared laser that is minimally invasive. It's just a light that basically goes on your foot and ankle and stimulates a healing response all the way down to the organelle level of the cells, even the mitochondria, and helps the body heal things, especially chronic injuries that people have had issues with. So that's one of the therapies that we really like because it's painless, it's non-invasive, and people do see a great response from that. Additionally, other things, shockwave treatment. If you look in the sports world, shockwave is all over the place. Within our institute, I'm part of the Wild Foot and Ankle Institute. They're larger umbrella. They're based out of Chicago. We have multiple papers for things like Achilles tendonitis and plantar fasciitis that show that shockwave therapy is equal to or more effective than surgical intervention itself. And shockwave therapy is basically bombarding the tissue with ultrasound shockwaves. And what that does is, again, stimulates a healing response in areas of our body that don't want to heal. And things that don't want to heal are things that don't have a vascular supply, like tendons, ligaments, all the things that tend to bring people in the office in the first place, like plantar fasciitis or Achilles tendonitis and things like that. So shockwave is definitely a game changer. And then, at the same time, we want to, pony up on therapies and combine things that work. And one adjunct that we've found that is fantastic with shockwave therapy are amniotic regenerative injections. And that's a regenerative medicine technique whereby we basically inject amniotic tissue that helps regenerate and heal ligaments and tendons that have chronic problems in them. And the use of those two together with regards to the majority of pathologies that we treat is as effective or more than surgery. And it keeps people out of the OR as well. So those are some of the things that we engage. Obviously, there's many more, but those would be the big ticket items that help, especially with our high-level athletes who don't have the luxury of taking that much time off to maybe go through a surgical intervention. It's something that's easy, minimally invasive, painless, and can be done in the office with little to no downtime and essentially no recovery time as well. So it's really revolutionized the way that we've done things. And those modalities, they're new. Shockwave's been around since 1998-ish. But with regards to in-office use, it's only in the last few years that we've been able to do that. And it's really revolutionized the way we do things.
God, I appreciate you sharing that. That's really cool. And that's a really great perspective because, like you mentioned, a lot of that stuff's been around for some time. But I know a lot of people don't necessarily know about the full gamut of things that can be done to help prior to or in place of potential surgery. So I think that's really cool. And obviously, as a surgeon yourself, there's a time and place for this. But
there's a time.
Absolutely.
Yeah, there's a time and a place. And additionally, when we talk about engaging new cutting edge techniques, it's great that something's out there, but people are always hesitant to engage them because honestly, they don't know if they work or not. And the one thing I stress about our practices is that I'm a leading a publisher in our field. I write lots of papers, and everything we do is evidence-based medicine. So if there isn't good data out there supporting it, we don't do it. And as a group who is very actively involved in creating that data, that allows us to be on the front end of things and being able to quote people, percentages of this is how much better you're going to get, here's how long it's going to take compared to other therapies, and be able to speak to that really from a firsthand experience, because in many cases, we're the ones that have written these papers.
That's awesome. That's really helpful. So if anybody watching this is ever, wondering, hey, wants to go see Dr. Matthews and is questioning any of his suggestions, hey, ask him for the research. I bet you it's out there.
Yeah.
I love that, and that's so much that just gives so much validity to what you're doing. Now, I'm sure a lot of people out here watching this have some some ankle issues, or dealt with some of these things in the past, probably pretty active themselves. So if they're watching this and they want to come see you, what is the best way to contact you?
There's a number of different ways to do it. So our website is paulrossdpm.com. Additionally, if you live in the DC metro area, you can just Google the Podiatry Center or podiatrist, and we're like the first person that pops up every time. We have same day appointments. Our office numbers are all on there. We're obviously also on Twitter at the Podiatry Center, Instagram at the Podiatry Center. And you can reach out to us through there as well. But we pride ourselves on accessibility, so we do have same days. And my biggest recommendation to people out there would be, you got to be proactive, and the way to be proactive is if you have something going on, don't ignore it. Reach out, meet with one of us. We have telemedicine visits in this COVID era, and all those things available as well. And it's not hard to do. So I'd encourage people to be more proactive in terms of getting to the root of their problem versus letting it, fester for a while.
Absolutely. Totally agree, because you're right. As a good rule of thumb, the longer we let something wait, the longer it takes to go away.
Yeah. The harder it is to get rid of it. So
exactly. And I can definitely testify that the Dr. Matthews is definitely an expert at what he does. I know we definitely trust him with the care of any of our patients. And Dr. Matthews, first off, obviously, I appreciate you still being able to be available to help your patients during this challenging time, especially via virtual sessions. So we do that as a PT practice, and I know I've heard great.
You guys have been very involved in that. I know that.
Yep, and I've heard great things about the folks who have. So I've seen firsthand the help it can provide, and I know I've heard also about some of the great help that it can provide for your patients as well. So if any of you are interested in scheduling an appointment with Dr. Matthews, I'm going to have a link to their website with some information regarding their contact information as well, right below this video. So first off, so Dr. Matthews, I really appreciate you joining us today. This has been awesome.
Appreciate you having me on. It's been a blast as always.
Hey, it was a benefit for me. I learned a whole bunch of stuff. It's going to help me. So I appreciate it. And hopefully we'll get a chance to do this again sometime.
Absolutely. Anytime.